I think when we start to move towards shared care records, we're building on some fantastic local examples, but that localisation is generally around fairly small populations at the moment. What we're working through is how do we have broader conversations across a bigger population? How do we bring the organisations together, create a shared vision and create a shared commitment to bringing those records to life? There's a massive piece of work to be done about how we engage with patients, public and citizens to build trust. We know that we're not necessarily in a good place in all cases in terms of public engagement with this agenda, but also we've got to balance that expectation that generally for direct care, records are already shared. So there's a balancing act there, I think. I think to bring those organisations together, we're relying on a shared vision being created that is something that has resonance within localities but also on that broader footprint. So it might be that we build on sort of town-based initiatives into a broader population initiative. And to do that, organisations have to be very clear about what the benefits are that are being delivered, and they have to be very clear about how the data, flowing data across there is going to benefit those patients, it's going to benefit clinicians, and it's going to benefit the system overall. So it requires local leaders, both with vision but with enthusiasm and with really good engagement skills to bring people together and work through the difficulties where it might be that investment is going into one organisation and not another organisation. It's always bringing it back to where are the best benefits derived for that whole population. Creating both digital leaders, those people with a technical background who lead others, but also raising the awareness of the digital agenda with leaders more generally is really important, and both of those aspects need to be brought forward. I think we are seeing the birth of strong digital leaders now. They need to be supported. There are national initiatives around the academies, the leadership academy, that kind of thing, that really creates an environment that values these people and helps them to engage with non-technical people. We're moving digital and technical out of the backroom and into the light, really. And to do that, we need to understand that we need to support the people who are part of that and help them to articulate the enthusiasm that they've got, so that that's, in the context of how do we deliver care more broadly. I think we've got lots of local examples of real engagement, real enthusiasm. In the Northwest, we've got a lot of good work that's happened in North Mersey around the care records. There are some excellent YouTube videos starring Dr. Simon Bowers, who really starts to put the context around why we share records. Which are incredibly helpful. There's a lot of good work that's happened in Manchester around research and the engagement of people in that research piece. And then we've got local shared records. We've got Cheshire, we've got Lancashire, we've got work that's happening around Cumbria. There's a lot of work going on around telehealth and how do we manage that information flow in a more indirect way. So we've got fantastic things to build upon. And that's true across all of the North. It's true across all of the country, but it's certainly true in the North. And things like the North Digital Partnership, I think, are going to provide the framework to help us to learn from each other and to build on the best.